we are joined again by Sam from Morgan's Osteopathy with us here at the Healthy Society Health and Fitness Centre. Now, Sam, there's a buzz sort of theme going on at the moment for the 40-plus demographic, and that is strength training. So for women, it's strength training for your hormones to get through menopause better, to prevent osteoporosis as we age. For men, it's strength train, maintain your testosterone levels. And for everyone, just be more resilient and don't get old as you age. It's aging, not getting old, right?
Yeah.
But us and you,
we
have a common theme in people. Even 30-year-olds this affects.
Yep, myself included. Yep.
Is that they've been doing not much.
Yeah.
And then all of a sudden they think, shit, I need to get out and do something. I'm going to go out and start running. Or my doctor's told me I need to lose 10 kilos. So what's the best way to do that? I don't want to spend too much money on it.
Yeah.
I'm just going to start running.
Jogging around the block.
Yeah.
I think the classic is the couch to 5K, for example. Yes. Or we see a lot of people who've barely run for a number of years and suddenly decide they want to do half a marathon with their fellow family member or something like that.
Or the old, I used to play footy. You were a gun at AFL when you were 19. And now at 40, I'm just going to start running like I did when I trained for AFL.
I mean, I'm 32 now, and last year at the age of 31, I'd spent only 1 year away from intense exercise. And what I mean by that is netball, basketball, soccer. And then I decided to play soccer, and that not immediately, but within a few months resulted in an injury. You don't need to be 40 years old to get these injuries. Unfortunately, it depends upon your conditioning prior to that. And we're all deconditioning from the age of 30 onwards.
As a nation.
Yeah.
And the key thing about that is, like, you were playing sports, you were active, and then a year of inactivity. You went from doing maybe a run a week.
Yeah.
On the weekend, maybe.
Yeah.
To 3 training sessions a week, plus the practice games. So you're playing soccer 5 days of the week, basically. You went from 0 to 5 days.
Yes.
Which is kind of, that's a 500% increase.
With minimal recovery is probably worth mentioning as well. And I guess that's what we're getting at here today. When you do decide to take on something like this, it can be really important to promote recovery. And that comes in many forms. That could be stretching. That could be something like using an infrared sauna. That could be prioritizing some cryotherapy, whether it be jumping in the beach after your sports session. There are so many ways to promote recovery, but we're also trying to lean into the fact that we should be conditioning ourselves a little bit more and checking for any potential predispositions to injury before you jump into something like a couch to 5K.
Yeah. And like I use the analogy. If we're going to go driving across the desert, we're going to go from coast to coast, east to west.
Yeah.
What do you do first? You go get your car checked out. You make sure your tires are right. You change the oil. You've got your jerry cans full. You've got all of the stuff that you need prepped, primed and ready. But then for some reason we think we can go from couch to 5K after not doing anything, not checking our joints, i.e. your wheels, not checking that your feet are tracking straight, your wheel alignment. And then all of a sudden we see you with torn plantar fascia, shin splints, knee problems, sore lower back. So we're not saying don't do the couch 5K or don't start the new exercise regime, because that's very, very, very beneficial to the 80-year-old you who wants to be independent still. But get a servicing first. Find out what your injury risks are. Like, hey, mate, did you realize that your ankle is actually quite seized up? You just start running on that, you're going to give yourself some sort of shock issue. Yeah. Whether that's at the plantar fascia, the ankle, the calf, the knee, we're going to end up having. Yeah. So number one thing is just get an assessment done by someone.
Yeah.
It could be with us as a movement assessment, like a trainer type person, if they do a movement assessment. In my number one thing there is when you're interviewing someone, actually check them out first. Ask them, have you had an injury yourself that you have resolved? Or what type of people do you see that have had injuries and you've helped them resolve it? That's really important. Whether you see me, Sam, or anyone else out there in the whole country, find out if they can do that, because especially for the 40 plus demographic, or if you've had some sort of injury before, like I myself am very careful with who I choose to entrust my body to. And so you should have the utmost care for yourself as well. I think it's an important thing.
Yeah, definitely. I guess to expand on what Larissa's saying about coming in and getting an assessment, those assessments can look something like as simple as watching your walking gait, seeing what's happening when you put certain joints under load, i.e. through something like a squat. These are things that I know Larissa does in her sessions as well. And we're essentially just looking for any faults, any breaks in the chain, biomechanical chain that might be letting you down when you suddenly decide to put your body through a lot of load, often quite compressive load when it comes to something like running. But it could be anything. It could be anything like starting an F45 program or a gym program of any kind. You want to make sure that you're addressing certain things in a slow graded manner.
Yeah, right. So that would be our number one tip for anybody who's going, right, I want to be aging well. I want to have my testosterone still when I'm 60, 70 as a guy. I want to have strong bones, women. Please, please, please service your vehicle first.
Yeah.
And bulletproof yourself before you get the injury. Prevent the injury rather than responding to the injury. And then you can perform better and for longer and without pain, hopefully.
Yeah. Thanks, Larissa.
Thanks, Sam. Enjoy. Okay.